The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to another video, and today we are going to talk about heartburns, right? Heartburn, that discomfort which you feel in between your chest, the burning sensation, painful burning feeling which is just below your and behind your breastbone, below and beyond, right? That is heartburn, right? Most of the time it comes from the food pipe, most of the times, right? The pain often actually rises inside your chest from your stomach, and it may also spread in your neck or throat. That is called heartburn. That is totally different from gastritis or an ulcer, stomach ulcer, or an indigestion, right? We have already seen that, right? So heartburn is this. Now almost everyone has heartburn sometimes or the other, and it is, if you actually have heartburn very often, then you may have what is called as gastroesophageal reflux disease, GERD, right? So GERD is a different topic, but then heartburn, what happens when you have heartburn, right? Normally what happens when the food or a liquid enters the stomach, there is a band of muscle at the end of your food pipe, which is the esophagus, which closes off the food pipe so that the food, stomach, the food cannot come up, the acid cannot come up when the stomach is churning the food, right? This band is called lower esophageal sphincter, LES, right? If somehow this band does not close tightly enough, this food or the stomach acid can actually back up and reflux back into the food pipe, into your esophagus. All the stomach content is not meant to be coming back into the esophagus, and therefore it irritates the esophagus and causes heartburns and all the other symptoms. So this is what happens in GERD, this is what happens in heartburn. This heartburn can be more likely if you have a hiatus hernia. What is a hiatus hernia? You'll see there's another video on that, right? Hiatus hernia is something where a part of your stomach which should be below the diaphragm is the muscle which separates your stomach and your chest, it comes up into the chest part in the mediastinum. That's called hiatus hernia, right? In that case, there are more chances of having this lower esophageal sphincter dysfunction and the heartburn, right? This is what has happened. So the weakening happens of this lower esophageal sphincter. Then there are certain other conditions also, like pregnancy, which can lead to more chances of heartburn. Obviously pregnancy, everyone who is pregnant will have at least one episode of heartburn, and medicines can also lead to heartburn. Some medicines, many Ayurvedic, homeopathic as well as allopathic medicines can lead to heartburn. Then what kind of medicines can lead to heartburn? Any medicine which is anticholinergic. Well, anticholinergic means any medicine which is used for seasickness, motion sickness, any medicine which is used for that can lead to heartburn. Beta blockers which are used for blood pressure and heart diseases can lead to heartburn. Even calcium channel blockers which are used for blood pressures can lead to heartburns. Then Parkinson's disease medicines like dopamine can lead to heartburn. Even progestins which are used for birth control or abnormal menstrual bleeding can lead to heartburns. Sedatives like anxiety which are used for anxiety and sleep problems, insomnia, sedatives, sleeping pills can lead to heartburns. Asthma medicines, right? Lung disease medicines can lead to heartburns like theophylline and any kind of medicine, lung medicines can lead to. Tricyclic antidepressants can lead to heartburns, right? So the antidepressants can also lead to, these kind of medicines lead to heartburn, dysfunction of your lower esophageal sphincter and reflux. So you should talk to your doctor if any of these medicines are there in your routine and you are having heartburn. Then you should talk to your doctor if you can change it, or if you do really need it, right? Don't stop or change your medicine on your own. Never do that. It can lead to a lot of side effects. So instead, what you can do, there are some home remedies, there are some things which you can do to take care of this. The first and most important thing, you should treat heartburn on time, because if you have this reflux very frequently, then this can damage the internal lining of your esophagus, of your food pipe. Obviously, repeated burning can damage, and this can cause some very severe problems over time, and even increase the chances of esophageal cancer, right? So you need to change your habits, your eating habits, your dietary habits, your lifestyle, and this will help in a lot aspects of preventing heartburn and even other symptoms of GERD, right? I can give you a certain tips which will actually help you a lot for GERD as well as heartburns, and you can talk to your doctor for any additional tips which you want. The number one thing is to avoid certain types of things and drinks which are known to trigger these reflex heartburns. Number one is alcohol, caffeine, any carbonated drinks, chocolate, citrus fruits and even citrus fruit juices, then peppermint and spearmint, spicy or tangy fatty food, full fat dairy products, right? And even tomatoes and tomato sauces. Yes, you should avoid them as much as you can if you have repeated heartburns, right? Like, try changing your eating habits also. For example, avoid bending over or exercising right after eating. Don't bend over, don't exercise, don't lie down right after eating. Avoid eating within 3 to 4 hours of bedtime. That means, right, if you have, so basically don't sleep for 3 to 4 hours after eating, right? Lying down on a full stomach will cause the stomach contents to press harder against the lower esophageal sphincter and can lead to reflux, right? Then the next thing is eat smaller meals always, because you should not fill your stomach completely ever. You can eat every 4 hours if you want, or 6 hours for that matter, but don't fill your stomach up. Eat small frequent diets. Then you can change your lifestyle. It's very important to do that. You need to avoid lifting belts, avoid fitting belts, a lot of belts and all, or clothes that are very tight around your waist. These are not good for you, because these items can squeeze the muscle and can actually force the food to reflux. That can happen. Then you should lose weight if you are overweight, because obesity increases the pressure in the stomach. Obviously, there is a lot of fat and it increases the pressure, and this pressure can push the stomach content more into the esophagus, and in some cases even GERD symptoms who have these things can go away if a patient loses weight, like for example 10 to 15 pounds, right? 4 to 8, 9 kilos. If you lose that, sometimes your GERD symptoms go away, right? So you should lose weight. Then sleep. You need to sleep with your head raised 6 inches raised, or you can sleep with the head higher than your stomach. That's the idea. You can just elevate the bed a little bit or keep a pillow. Both the things you should do, and this can help prevent the digested food from going back into the esophagus because of gravity, obviously. Then you can place things like books or bricks or blocks under the legs of the bed also, to just tilt the bed, right? That can be done. Or you can also use a wedge shaped pillow under your mattress or something like that. Or you can sleep on an extra pillow, but that does not work so well, because you're just slipping off the pillow. You might just slip off the pillow in the night. Obviously that happens, so you should tilt the bed. All right. Then next lifestyle change is stop smoking, right? And all the chemicals in the cigarette smoke are very harmful, and they are known to weaken your lower esophageal sphincter. That's problem. Then you need stress. Stress is a big factor which causes reflux, and you need to relieve stress by yoga, meditation, exercise, sleep, relaxation. This is important. If still you do not get full relief, although if you follow all these principles, then definitely you should get relief. If still you do not get relief, then you can try over the counter medicines like antacids. Antacids basically just like Digene or other things, basically just help reduce the stomach acid productions, basically just neutralize the stomach acid. H2 blockers like pantoprazole, rabeprazole, they can also be taken because they can reduce the stomach acid production, so that acid is produced in less amount, so it will reflux in a less amount, obviously, because the amount is less. That can help, like proton pump inhibitors, etc., etc. But they have to be taken before you eat, before even you think about eating, half an hour before food, because if whenever you think, your mouth becomes watery, same thing, your stomach starts producing acids, right? But even if after all these things you have problem, or especially if you have any kind of vomit which is blood colored or look like coffee ground, then you should go to a doctor. If your stools are black or tarry, still you go to a doctor for evaluation for health conditions, liver problems, etc. Or if you are feeling burning feeling or squeezing, crushing feeling, pressure on the chest, sometimes that can also be a heart attack. That's why get an ECG, get evaluated. Right. So remember, if it is not going away for a few weeks, or if it is starting increasing, if you lose weight, if you're losing weight and you don't want to, right, and you're having these kind of reflux, then you can be a cancerous sign. If you have trouble swallowing food, that means the food actually feels like it is stuck here, does not go down, then you need evaluation. If you are coughing and sneezing, and that is not going away, then also you need symptoms. And if your symptoms are not going away by all these medicines, H2 blockers, antacids and other treatments, other lifestyle changes, then you need to go to a doctor, right? Obviously your doctor will ask a lot of questions and do take the history, ask you a lot of things about all these things, with how is your stool, how is your any problems with how much alcohol, how much caffeine, how much sleep, how much smoke, and how much stress you have. They should ask all these things, what kind of diet you take, because all these things need correction. And you might need to do some tests, like the test, there is a test by which we can actually measure the pressure on the lower esophageal sphincter. This is called esophageal motility test, and even endoscopy in upper esophageal endoscopy, duodenoscopy, upper GI endoscopy can be done to look at the inside of your esophagus, stomach, how much damage has happened, how well it is right now, right? This and even upper GI capsule endoscopy is also there, which can actually look at the entire intestine. So a lot of tests are there which can be done, right? If your symptoms don't go away by all these things, don't forget you can always have an option to go to a doctor. The best doctor here is gastroenterologist, right? So all these things, GERD, heartburn, pyrosis, all these things, like esophagitis, are the same thing. This is the same thing which is happening. Stomach is getting up, more chances if you're having hiatus hernia. Make sure to share this information to the needy people, right? You never know who needs this information, therefore share this information. I'm Dr. Paramjeet, you're watching Dr. Education. Stay connected guys, stay healthy for more such videos. Bye-bye.